Hello, my name is Shayla Perez, and my presentation will be on FELV, or feline leukemia virus. Okay, so FELV, feline leukemia virus. The illness or medical condition is a retrovirus that can be passed from cat to cat through saliva or nasal discharge. It commonly causes anemia or lymphoma, and it suppresses the immune system, predisposing cats to deadly infections. It worsens over time and is usually fatal if not treated. The symptoms of this condition include pale or white colored mucous membranes, icteric sclera or yellowing in the eyes, enlarged lymph nodes, bladder, skin, or upper respiratory infections, progressive weakness or lethargy in chronically infected cats, fever, diarrhea, and dyspnea. Unspayed female cats will show reproductive issues, and all cats will eventually develop stomatitis or tongue ulcers. There is no cure currently specifically for this illness. However, 70% of cats who encounter the virus are able to resist infection on their own. Blood transfusions can be done for related symptoms such as anemia or chemotherapy for cancer. Immunotherapy medication can also be given, dental extractions to help with the stomatitis, and IV fluid therapy can decrease some of these symptoms. This is diagnosed with a test called an ELISA. It identifies blood proteins or FELV proteins in the blood. It is a common infection. 2 to 3% of all cats in the USA are testing positive for FELV. Cats who test positive often have a poor long-term prognosis and are unlikely to clear the tests. Treatments for this illness, there is one drug, AZT. It's the only known drug effective against FELV, but it does have serious side effects. As stated earlier, there's no specific medication or treatment for FELV. The blood transfusions and the other medications can help with some of the symptoms. Eventually, a cat with FELV will develop secondary diseases like cancer that may warrant hospitalization. The length of that hospitalization can depend on the severity of the condition, and it's usually only done to stabilize the pet. Once they're stabilized, it's all about just symptom management. As a veterinary assistant, our role in helping treat this condition or these animals with these conditions is to educate the clients on how to best comfort their pet. Since it is a fatal disease, we must be empathetic to their situation, but we must also be realistic. We can't make any promises that we won't be able to keep. And we should also keep an eye out for any worsening side effects at the follow-up visits. So we need to ask the clients the correct questions and educate them on what to look for. The considerations that will be discussed with the client. So keep an infected cat indoors to reduce the risk of infection by other cats. Schedule regular veterinary checkups. Avoid contact with any unvaccinated cats, and flea treatments also help. So follow-up care, yes, every 6 months, a appointment should be scheduled to, again, monitor the conditions that may arise with FELV. And we should monitor the weight, the appetite, activity level, elimination habits, how often they go poo and pee, the appearance of their mouth and eyes, and behavior. It's an important part of managing the disease as well. So preventing this illness, we must educate every single client about these life-saving vaccines. It's recommended that most kittens get a shot at 12 months of age at least. And an owner would only need to seek medical attention if serious signs of disease are explicitly present. Here's my works cited page. Okay, thank you for listening to my presentation on FEOV.